Hello and welcome to Drug Error Talk. I'm Matt Hamilton. Today we're talking about Tramadol, how overdoses occur, the consequences on the human body, and what to do should an error cause you to have an overdosage of it. I'm joined here today by Doctor Jesse Garcia. As you know, I am a trial error attorney specializing in victims. Dr. Garcia, what is your specialty?
Well, Matt, I am a clinical pharmacist specializing in drug interactions and the effects on the human body.
Let's talk about Tramadol. What is Tramadol?
Tramadol is a pain medication that we typically see. It is not nearly as strong as some of the opiates, the hydrocodones, the oxycodones. So you typically see a patient who has maybe had surgery to maybe repair a broken bone. They might get a little bit of hydrocodone and then continue on with some Tramadol to help with pain.
Why Tramadol instead of the normal opiates like hydrocodone, oxycontin, those sorts of things?
The medication isn't as potent. That's part of it. The other thing is you don't see some of the same gastrointestinal side effects, so you might not see the constipation, which is usually associated with some of those opiate drugs.
Can errors occur in the giving of Tramadol?
Tramadol itself is often overdosed in terms of the number of tablets that a patient should take in a day. Typical dosing that you would see for a patient taking it would be 1 to 2 tablets every 4 to 6 hours as needed for pain, which would mean that the patient could take at a maximum of 12 tablets a day, which would put their dose at 600 milligrams of the medication a day, when in fact the maximum dose recommended is 400 milligrams. So on a typical dosing, if you're taking it around the clock, you would see that you would reach that maximum dosing fairly quickly.
Who's making these errors?
Sometimes we see it from the physician side, where the dosing is just prescribed as such as the 1 to 2 every 4 to 6 hours. That's usually where we see it, and we try to stop it at that point with a maximum of 8.
Can pharmacies fail to catch this as well?
Pharmacies can. Typically, from the pharmacy side, when it's being run through the insurance, most insurance companies are going to reject it and say the maximum is 8 tablets a day, and then it's our job to then let the patient know, even if the doctor says they can take more, that the recommended dose is still 400 milligrams, and that should be the max that they should take.
So you can have a Tramadol error either from a physician, a pharmacy, or even an insurance company?
Correct.
Okay. Well, let's say you're a patient, you're taking Tramadol. How would you know if an error had been made? What should you feel or exhibit?
Well, what you typically see is what we would want to watch is we would want to watch whether or not, and especially on the physician side, if they're doing blood work to confirm that there is that the kidneys are functioning properly. As the kidney function decreases or goes down, you would want to see the interval go up, meaning how often you take the medication. So if your kidneys aren't working as well, you would want to see the interval or the length of time instead of every 4 to 6 hours, maybe you go to an every 8 to 12 hour or an every 12-hour dosing. So that's something that we definitely can see happen. As far as consequences?
Yeah.
Consequences, okay. So what you can typically see with that is it can, in some cases, cause seizures. It can also cause or be a contributor to something called Serotonin Syndrome.
What is that?
Serotonin Syndrome is a syndrome where the body has an excessive amount of serotonin. Basically, it's a feel-good chemical neurotransmitter. And you can get a collection of the serotonin in the brain, even from other parts of the body. So you would think, well, why would this medication have any effects on the brain? Well, you have serotonin that's in your blood that helps keep your blood stable, specifically the platelets. And what can happen at times is if you take too much of the pain medication, the serotonin can move into the brain. Okay, and in some cases in combination with depression medications like maybe a Citalopram, which is typically used for depression. Okay, and that's in a class of drugs called SSRIs. So what we see is the blood itself becomes a little less stable in terms of clotting because that serotonin is in the brain, because that's where the medication is being pulled to, or the neurotransmitter is being pulled to. So then what you find is that the platelets become less stable, and therefore if you do have any type of bleeding, associated with maybe post-surgery, or you get a cut in some sort, you might find that you have problems clotting. But on the serotonin syndrome side, you might see fevers, you might see chills, you could see muscle rigidity. In some cases, we see seizures. Just run the gamut of different consequences of that.
Okay. How bad can it get?
Untreated, like I said, you can see seizures. You can have problems with clotting. So that's kind of what you would see at the maximum level. This is the problems with Tramadol are not as common as some of the other medications that we might see, but it is one of those things that when you do see it, it's pretty potent.
Can it even lead to death?
Eventually, untreated, yes.
Okay. Wow. Well, let's say you're a patient, you're taking Tramadol, and you're concerned that an error has been made causing an overdose. You may have seizures or clotting or some of this rigidity that you're talking about. What should the patient do? In
this particular case, depending on the specific effect you're seeing or symptom you're seeing, you would definitely want to get a hold of the doctor and let them know this is what's going on. Now you may be asking, okay, is this a life or death emergency? Do I need to go today? Do I need to go tomorrow? In the case of if you're having a seizure, having clotting problems, you probably want to get seen now. I wouldn't wait. Bring your updated medication list so that they know what you're taking and they can make the assessment from there. In the case of maybe you're feeling maybe a little dizzy, in some cases you'll just want to maybe just hang tight. You can contact the doctor the next day. And in most cases, what they do if the symptoms are not life-threatening, they'll remove the agent or just have you back down the dose and not take as much. They might give you a different medication.
Should this be ignored?
Definitely not. Definitely not. You shouldn't ignore any side effects. Any effect of the medication is an important effect, whether it be good or bad. It either does its job, you feel good, or it doesn't do its job, and you have it in a side effect. And in this case, if you're having those effects, you should, at least, if nothing else, contact the doctor or call your nurse's line and see whether or not they want you to be seen. Okay. If it's a situation where you need to get in and get seen, like you're having a seizure or you're having clotting problems, then that's a case where you want to go and get seen now.
So if you're taking Tramadol and you're having one of these side effects, you're concerned about an overdose, it's not a judgment call as to whether to see your doctor and tell them about this. It's simply, do you need to go to the emergency room right away or contact them the next day?
Correct.
Okay. Well, thank you, Dr. Garcia. We appreciate you coming in and helping us with this Tramadol. This has been Drug Error Talk. For additional information on Tramadol, its effects on the human body, and anything else you'd want to research, I direct you to our website, law-kc.com, and also look on our YouTube channel for additional videos talking about drug errors. Dr. Garcia, thank you. It's been a pleasure.
Thank you.